Hello, my name's Tom Griffin, and I'm the Chief of Police here in Peabody. And I wanted to introduce you to a couple of folks who I met when I first came over here about a year and a half ago. This is Sarah Grinnell and Sandy Drover. They're the two women that run the Healthy Peabody Collaborative here in Peabody. It was something that I wasn't aware of when I came over, and I was very happy to find out that they were situated here with the police department. Kind of continuing on the theme, when we talk to the school resource officers, it's very important to the city of Peabody and everybody here in the city how we take care of our kids. And these two ladies are two outstanding advocates for the kids here in Peabody. And I just thought it was important for me to introduce them to you folks out in the community if you don't already know them. Their key phrase is above the influence, and they try and get kids to make the right decisions so that they stay above the influence of any kind of negative behavior, basically. And I'll let them explain that a little bit more. But Sarah, can you fill me in a little bit about how it is your organization came to be?
Yep. So the Healthy Peabody Collaborative was formed in March 2008, and that was under former Mayor Bonfanti. It was a collaboration of the mayor's office, the health department, and the police department, along with the school department as well. And they created the collaborative in response to the substance abuse issues in the city. They wanted to be able to address the issues in a preventative manner. So the prevention, we start down all the way at elementary school, but initially most of our prevention efforts were beginning at the high school level. So March 2008, the Healthy Peabody Collaborative was formed. They applied for funding from the state, and we were lucky enough to receive that. So July 2008, I came on board, and Sandy came on board shortly after, in September or October of 2008.
The rest is history, huh?
The rest is history. So our initial source of funding was through the Bureau of Substance Abuse Services through the state of Massachusetts Department of Public Health, and that was primarily for underage alcohol enforcement.
Alcohol?
So that's how we ended up being seated in the police department. It made the most sense. From there, we applied for federal funding that allowed us to expand our focus into the prevention of tobacco, alcohol, marijuana, and prescription drug use among the young people in the city. So really the focus is stopping them from ever starting. So before
Sure.
they take that first drink or smoke that first cigarette, not on the intervention level. So
Okay.
we're really, as
Preventing.
preventing, exactly. So we've started our prevention efforts primarily at the high school, moved down to the middle school, and now many of our efforts happen at the elementary school level, which is really exciting.
Sure.
We use social norms are a way that we try to prevent, changing the norms of the community so that Peabody is a healthy place for kids to grow up in. The Above the Influence campaign is the big social norms campaign, as you mentioned.
And by social norms, you mean like changing the attitude of people that it's not okay if you're in high school to drink.
Yep.
You need to change that to it's okay to say no, and it's okay, you're all right if you do. So
Exactly. So in 2010, we were contacted by the federal government to be part of a pilot program, and that's when Sandy went down to Washington, D.C. for the first time to get some more information about that.
do you want to talk about that, Sandy?
Yeah, and the Above the Influence campaign target audience is grades 6 through 12. We're very mindful that this is a community-based grant, and we complement that with another large-scale social norms campaign called the Asset Model from the Search Institute. But as Sarah said, we did focus on the Above the Influence campaign at the beginning, and we got to leverage the national campaign at a local level, and we've been very successful with that. You can notice the Above the Influence arrow all around the city, most prominently displayed on backpack straps from backpacks for high school students and at the middle school. And we have that arrow available, and we use that as our primary social norms, positive social norms campaign marketing tool at both the middle and the high school. And then there's been a ton of activities around that campaign. We've had art contests, and we've had
Is that the bookmark contest that
well,
you do?
the bookmark, like Sarah said, some of our efforts have trickled down naturally to the elementary school level because we hear from the community all the time that we need to start before high school. So then we went down to middle school, and now we're in the elementary school. And the bookmark contest, it's a great thing to bring up because one of the things about our coalition is a lot of our activities are youth-led, youth-driven, and that idea came from one of our high school leaders to how can we do prevention work down at the elementary school, because that's a tricky conversation to have with little kids. And
Sure.
and we kind of come at it from the back door, and we have more of a healthy youth development approach to it, and that's when we implement the asset model. So in thinking about how we could engage the elementary school, we put that out to our youth leadership group at the high school in one of our summer youth summits. And we were already doing some work in 4th and 5th grade, and they wanted to figure out what would be appropriate for 3rd grade. So they came up with the idea of a bookmark contest. They reviewed the list of assets and tried to pick out what would be appropriate for grade 3, and they came up with what makes a good friend. So
Sure.
it's a simple message, but having friendship skills, the ability to make friends, surround yourself with good friends, is one of the 40 things that you need as a kid to be the best that you can be. So that was a great, easy message that they could grab onto, and they were just asked to create a bookmark using words or pictures on what it takes to be a good friend. And then you, this year, were involved as a member of the Rotary. We engage a lot of different sectors in that, of the community, in that undertaking, again, recognizing that it's a community grant. And one of the largest partners in that is the Rotary, which I know, Chief, you became a member of this year. And the Rotary, is part of our elementary school prevention activities, and they read the essay contest that we put out in grade 4, and then they get to see, first and foremost the bookmarks, and the kids at the high school actually judge the bookmarks, and then there's a winner from every elementary school in grade 3. Grade 4, they have a winner from every grade 4 classroom for the essay contest. Then we go out, we do a big presentation or a little presentation, whatever the school wants from us in all 8 elementary schools. We've done 7 so far this year, and we have Brown School on the docket very soon. And we bring the school resource officer with us.
Officer Cochran was
Yeah, we bring, so
talking about.
law enforcement is part of that realm of people that we gather to support kids in a healthy way. The Rotary, we're there, the school administrators, the teachers, the students, they're all on board, and then also our leadership board at the high school. So there's a lot of good stuff happening around healthy youth development in the city.
That's excellent. Now, you do some programs during the summer?
Yeah, well, we have a youth leadership summit that we run. It's 2 days. We do 1 day team building. That's primarily with our high school group. We did invite kids last year that were 8th grade going into 9th grade to try to get them ingrained in the group. And so 1 day is spent doing team bonding, that kind of thing. We've done different things with them, but most recently to the Project Adventure in Beverly, a really fun day. And then the next day we do strategic planning. We lay out the school calendar, we look at all the things that are happening, and then maybe try to attach ourselves to some of the things that are already happening
In the school system?
Yeah, in the school system, and it's a pretty comprehensive approach that way, and it gets the youth involved.
And I think that was the initial goal of the group that, of the mayor's office and the health department, the school department, the police department, when they came together. They wanted to start the prevention efforts in Peabody, but they really wanted the young people of Peabody to take hold of that. So we've really progressed from it being adult-led to youth-led, which is wonderful.
'Cause I know the city is moving towards with the high school age kids doing a lot of community service and giving back to the community. So I think that they can funnel that through you guys quite a bit. When I first came here and that summer, was that the program you were doing up at City Hall?
Yes.
With all those kids?
Yeah, and it's great. We oftentimes for that, we actually hire a consultant so that they're not listening to Sarah and I all year long. And there's a renewed energy, at the beginning of the school year when we do it that way. We had a lot of hoorah things. And then I think the part that I invited you to when you first came on was the reporting out from the 2 days. And we give the kids opportunities to take the microphone. And I'm a big proponent of public speaking, getting them out and in front. Authentically, though, not, we don't put the words in their mouth, but we build them up to be the leaders that they are, and then the words come out naturally, and it's a real source of pride for sure.
Sure, that's great. Now, I know recently one of your grants has evolved into a more regional type situation. Do you want to talk about that a little bit?
Yep. So as I mentioned, the collaborative was first funded by state funding, and that was a 7-year grant. Since that time, that grant has ended, and they came out with a new source of funding that expands our efforts to work regionally with our partners in Danvers and then Tri-Town, which is Middleton, Topsfield, and Boxford. So we're very fortunate here in Peabody that our partners in those communities have long-standing coalitions. So they've been in existence as long as us and
So
longer, which has been it's nice because we all relied on each other previously, so that we were able to use each other's expertise and advice and campaigns and expand them. I always say the young people don't just stay in Peabody, they
Yeah,
travel
sure, they
between
go
all the
all around.
communities, so we want them to have consistent messages. With the expansion of the grant, there wasn't an expansion of funding, so I think that's one of the challenges that we're trying to work on, is moving forward, is to figure out how to sustain some of the activities that previously happened, now that we're looking at funding the work regionally, how that
Sure.
kind of changes what we do. And then we successfully reapplied for an additional 5 years of our federal funding as well, so that's
So that's
very
good.
exciting.
That's great. That's great. One of the other issues I know you guys work on is the opioid problem we're having, not just here in Peabody, but throughout the New England area. And can you talk a little bit about that?
So Peabody's fortunate, similar to the grant I just spoke about, that we're partners with Tri-Town and Danvers. We receive funding. Lynn is the lead on this grant, but it's for opiate overdose prevention and use prevention. That was added this last round of funding. So Lynn serves as the lead on the grant, and then we partner with Salem and Peabody.
Sure. Yep.
So we look at that grant set up a little bit differently. The work that we do, we work as a region, but we work more individually as our own communities. It
Yes.
really is an individual community problem. So we've worked with the police department and the fire department. All first responders now carry Narcan, which is great.
That's great. Yeah.
We're currently working on outreach teams to go out post overdose, and also to serve as as an ally in the community for people
Try and
that
get
are
people
seeking
help.
out help.
That's the bottom line with that, is to
Yeah.
get them the help they need.
And Sandy and I have had a number of community members reach out to us as well, and trying to figure out, through their experience and what they feel like would have helped them when they had a loved one struggling with this issue, and how to get those programs in place to really support the community, because it's the whole community needs to come together to address the issue. So we're moving on those pieces. Leahy's been a partner, the police department, the fire department.
Sharon Cameron plays a big role
Yep,
with
the
the health
health
department,
department.
because she's concerned about this issue within the city as well.
It's
So
a huge public health issue. Atlantic Ambulance. We just partners from all over the place. So we're looking to expand those efforts, as I said, and continuing with that regional grant through them.
excellent. What else is going on out there, Sandy?
Well, we have some good projects coming up for the kids. We're about to embark on a 3-tier PSA. It's going to be college-age kids giving advice to their high school self, high school-age kids giving advice to their middle school self, and middle school age children giving advice to their 5th grade self, recognizing that 5th to 6th grade is a transition time, middle to high school
Sure.
is a transition time, and certainly high school to college is a transition time, when you start to worry about some of those first choices that they're making, or
Sure.
negative and risky behaviors. That's very exciting. The kids, we've been working hard with the high school group on that, and we have some interns at the guidance department that are helping us out at the middle school. And I think that's gonna be really well received in the community.
Excellent.
I would like to just say, probably the best place to get our story, or Peabody's story around prevention, is Facebook. We're on all of the typical social
Sure.
media sites, but in terms of communicating what we're trying to do to the community at large, Facebook, and particularly our photos, tell a good story.
And the Healthy
So-
Peabody Collaborative has their own Facebook page.
we do, yeah. So check that out, like our page, and and I think there's something for everybody on that
Yeah.
page. Yeah.
Excellent.
And I think the social norms campaigns, you may be wondering why that's what we focus our efforts on. And, the role that we play in prevention in the city is to change the environment. So we use environmental strategies to change the entire community. So it looks at things like social norms campaigns, enforcement policies, that type of work. So it's not that we're necessarily working one-on-one with a young person, but we're working to just make Peabody the best place it can possibly be for a young person to grow up in.
That's excellent. That's a good goal to have.
Yeah.
Yep.
And you guys work hard, I know that. So
Mm.
thank you. Anything else?
I can't think of anything.
Okay. Excellent.
Thank you.
Thank
for
you. And
having
thank you
us.
very much for tuning in. And hopefully we'll see you again soon. Have a good day.